Welcome dear student. In my course named Determinant of Quality of Life, the topic is lifestyle diseases, in which we discuss the disease as diabetes mellitus. Content including in this module is introduction of diabetes mellitus, pathophysiology of diabetes mellitus, risk factors and diagnosis of diabetes mellitus, management and treatments of diabetes mellitus, public health and global strategies for diabetes, key takeaways and learning outcomes. Learning objectives of this module is to provide an in-depth understanding of diabetes mellitus, including its types, pathophysiology, risk factors, clinical manifestations, complications, and management strategies. The module will also explore the global prevalence of diabetes and its impact on public health, offering students and necessary tools to assess and to manage diabetes through lifestyle interventions, medical treatments, and public health strategies. Diabetes mellitus is epidemiology. Discussing this type, first is epidemiology, second is risk factor, diagnosis, complications, management, and technology of prospective future. Diabetes mellitus, a group of metabolic disease characterized by high blood glucose level, hyperglycemia, resulting from defect in insulin secretion, insulin action, or both. Types of diabetes mellitus: type 1 diabetes mellitus, that is T1DM, an autoimmune condition where the body attack and destroy insulin producing beta cells in the pancreas. It typically occurs in children, childhood, or adolescence. In normal life cycle, the insulin rupture the insulin receptor, that is glucose, is maintained in the blood sugar. In type 1 diabetes, the insulin is ruptured due to the immunotherapy and glucose high in blood sugar. And type 2 diabetes, that is the by insulin elevated in blood sugar and cells not accept insulin. Type 2 diabetes mellitus, T2DM, a condition where the body becomes resistant to insulin or does not produce enough insulin. It is the most common form of diabetes and is often linked to obesity, poor diet, and lack of physical activities. Gestational diabetes mellitus, that is GDM, a type of diabetes that occurs during pregnancy and typically resolves through after childbirth. However, it increases the risk of developing type 2 diabetes later in life. Other types includes genetic mutation, disease of the pancreas, or medication induced diabetes. Example, corticosteroid induced diabetes. Prevalence and global impact of diabetes. According to the World Health Organization, the global prevalence of diabetes has increased dramatically, with over 400 million people living with diabetes worldwide. The prevalence is especially high in low and middle income countries due to rising rates of obesity and sedentary lifestyle. Public health challenges. Diabetes contributes significantly to the global burden of non-communicable diseases and is a major cause of morbidity, mortality, and healthcare cost. Pathophysiology of diabetes mellitus is hyperglycemia. How increase hyperglycemia as intestine decrease in certain effect, fat cell increase lipolysis, kidney increase glucose reabsorptions, muscles decrease glucose uptake, brain neurotransmitters dysfunctions, liver increase HGP, pancreas increase glucagon secretions, and pancreas decreases insulin secretions. Causes hyperglycemia. Insulin and blood glucose regulation. Insulin functions. Insulin is a hormone produced by a beta cell of the pancreas. It allows glucose to enter cell for energy and help store excess glucose as glycogen in the liver and muscles. Blood glucose homeostasis. In healthy individuals, insulin maintains blood glucose within a narrow range, example 70 to 100 mg per dl. In fasting stage, insulin secretion is regulated by blood glucose levels, and when blood glucose rises, the pancreas releases more insulin to bring level down. Mechanism of diabetes. Gestational diabetes mellitus. In GDM, pregnancy-related hormonal changes causes insulin resistance. This result is elevated blood glucose levels, which may return to normal after delivery but may increase the risk of developing T2 diabetes mellitus in later in life. Type 1 diabetes mellitus. In T1DM, an autoimmune response destroys pancreatic beta cells, leading to absolute insulin deficiency. Without insulin, glucose cannot enter cell and accumulate in the bloodstream, leading to hyperglycemia. Type 2 diabetes mellitus. T2DM is characterized by insulin resistance, where the body cell become less responsive to insulin. The pancreas initially compensates by producing more insulin, but over time it becomes unable to meet the body's need, resulting in hyperglycemia. Factors such as obesity, inactivity, and genetics play a significant role in insulin resistance. Chronic hyperglycemia and complication. Acute complication. Diabetic ketoacidosis, a potentially life-threatening complication seen mainly in T1D diabetic mellitus, where the body starts breaking down fat for energy due to lack of insulin, leading to the production of ketones, acidic byproducts. Hyperosmolar hyperglycemic state, a complication more common in T2DM, where extremely high blood sugar leads to severe dehydration and altered mental status. Chronic complication is macrovascular complication, include coronary artery disease, stroke, and peripheral arterial disease by high blood sugar in blood vessels. Microvascular complications is damage to small blood vessels, can lead to diabetic retinopathy, vision problems, nephropathy, kidney disease, and neuropathy, nerve damage. Risk factors and diagnosis of diabetes mellitus. That is, age causes diabetes, increasing age, obesity, unhealthy diet, genetic predisposition, polluted environment, sedentary lifestyle, and alcohol consumptions. Risk factors for type 1 diabetes is genetic predisposition, family history of T1DM increases risk, autoimmune triggers, infections, example enterovirus, which can trigger the autoimmune process leading to beta cell destructions. Risk factor for type 2 diabetes is obesity, one of the strongest risk factors, as excess fat, particularly abdominal fat, promotes insulin resistance. Physical inactivity, that is sedentary lifestyle, increases the risk of developing T2DM. Genetics, a family history of diabetes, increase the risk. Age, risk increases with age, especially after 45 years. Ethnicity, certain populations such as African American, Hispanic and Native American populations are at higher risk. Other factors as poor diet, high in processed foods, sugar, hypertension and dyslipidemia. Diagnosis of diabetes mellitus is fasting plasma glucose, a blood test measuring glucose levels after fasting for at least 8 hours. A fasting blood glucose at 126 mg per dl or higher indicates diabetes. Oral glucose tolerance test, a test that measures blood glucose level after consuming a glucose-rich drink or OGTT, result of 200 mg per dl, higher after 2 hours suggested diabetes. Hemoglobin HbA1c, a blood test that measures the average blood glucose level over the past 2-3 months, and HbA1c of 6.5% or higher is indicative of diabetes. Type 1 diabetes mellitus is normal, is more than 5.7% hemoglobin A1c, HbA1c. Pre-diabetic is 5.6 to 6.4% and diabetes is more than 6.5% or fasting blood sugar is less than 100 mg per dl, or pre-diabetics 100 to 125 mg per dl, and diabetes is more than 125 mg per dl. Random blood sugar test not applicable for normal and pre-diabetic, and diabetes is more than or equal to 200 mg per dl. Management and treatment of diabetes mellitus. Lifestyle changes, that is healthy diet, regular exercise, weight management. Maintaining regularly checking blood sugar levels is crucial to managing diabetes. Medication is type 1 diabetes, insulin therapy is necessary. Type 2 diabetes medications, non-insulin injectable or insulin therapy may be prescribed. Lifestyle management. First is dietary modification, healthy eating, emphasizing a balanced diet with low glycemic index, food including whole grain, vegetable, lean proteins and healthy fats. Carbohydrate countings, important for both type 1 and type 2 diabetes. It involves tracking carbohydrate intake to manage blood glucose level effectively. Protein control, ensuring portion size and appropriate to maintain a healthy weight and avoid excessive calorie intake. Physical activities, regular exercise improve insulin sensitivity and helps in maintaining healthy blood glucose level, aiming for at least 150 minutes of moderate intensity aerobic exercise per week. Resistance training helps in building muscle mass, which in turn helps improve insulin action. Pharmacologic treatment. Gestational diabetes mellitus. Management typically include dietary changes and exercise with insulin or oral hypoglycemic agents used if necessary. Type 1 diabetes mellitus, insulin therapy, as T1DM involves absolute insulin deficiency. Insulin therapy is essential. Type of insulin includes rapid acting, short acting, intermediate acting, and long acting insulin tailored to the individual need. Pharmacologic treatment is diabetes. Type 2 diabetes mellitus is oral medication. Common medication include metformin, which improve insulin sensitivity, and sulfonylureas, which increase insulin production. GLP-1 agonists and SGLT2 inhibitors, newer classes of medication, help control blood sugar level by different mechanisms such as increasing insulin secretion and or reducing glucose reabsorption by the kidney. Insulin therapy. In more severe cases, insulin may be needed for T2DM management. Monitoring and ongoing care. Regular monitoring of blood glucose. Patients with diabetes should regularly monitor their blood glucose level using glucometers or continuous glucose monitoring system. Routine medical checkup includes regular assessment for complications such as retinopathy, eye exams, nephropathy, kidney function test, and neuropathy, nerve function test. Monitoring ongoing care is hemoglobin A1C monitoring, SB1A1C monitoring, help assess long-term glucose control and the effectiveness of management strategies. The target of A1C for most patients is below 7%. Public health and global strategies for diabetes. First is assess the diabetic status in the Americas and produce overview of diabetes in the Americas country scorecard. Second is stakeholder mapping and engagement. Identify and engage with key stakeholder organization including people living with diabetes. Third is technical support to member state to develop and implement diabetes intervention on quality of care, data and monitoring. Communications and awareness and education to raise public and professional awareness of diabetes. And resource mobilization is to raise necessary support for diabetes in Americas. Diabetes as a global health issue. Rising prevalence. Diabetes is one of the leading causes of global morbidity and mortality. It is a major risk factor for heart disease, stroke, kidney disease, and lower limb amputations. Public health policies. Government are implementing public health policies to address the growing burden of diabetes, such as campaign to promote healthy eating, physical activity, and weight management. Global initiative for diabetes. World Health Organization has developed the Global Action Plan for the prevention and control of non-communicable diseases, which aim to reduce the burden of diabetes and other chronic diseases through preventive measures and treatment guidelines. Diabetes prevention program. Evidence-based programs focus on lifestyle changes to prevent or delay the onset of type 2 diabetes mellitus, particularly targeting at risk population. Key takeaway of this module is diabetes mellitus is a prevalent chronic disease with significant health, societal, and economic consequences. The pathophysiology of the diabetes varies by type, with type 1 diabetes mellitus resulting from autoimmune destruction of insulin producing cells, and type 2 diabetes mellitus stemming from insulin resistance and beta cell dysfunction. Effective management requires lifestyle changes, pharmacologic treatments, and routine monitoring. Outcomes of this module is student will understand the different type of diabetes, their causes and pathophysiology. Student will be able to identify risk factors for diabetes and develop strategies for prevention and management. Student will be familiar with current treatment options and global public health strategies for combating diabetes. Thank you, sir.